Okay, good morning everyone. My name is Barransya Rayzard Dmitri Djasa from Biomedicine cohort 25 and also my ID is 25010058. And today I will be presenting my review paper discussing the progressive usage of stem cell based regenerative medicine in treating Alzheimer's disease and Parkinson's disease. Yeah, quite a long name, but bear with me. Rather than only treating symptoms, researchers are now exploring whether stem cells can actually repair damaged neural tissue and slow neurodegeneration itself. But before I begin, I would like to acknowledge my use of artificial intelligence or AI during the preparations of this presentation. AI tools were used to assist with grammar checking, improving sentence clarity, refining the academic tone of the script, and helping organize the presentation structure. Okay, okay. Alzheimer's disease and Parkinson's disease are among the most common neurodegenerative disorders. That is why we matter. Okay, so to further elaborate, both diseases progressively destroy neurons, leading to worsening cognitive decline, memory impairment, and motor dysfunctions. Currently, treatments mainly focus on symptom management, but they only temporarily improve quality of life and they do not stop neural degeneration. Because of this limitation, regenerative medicine has become a major area of interest. Regenerative medicine and stem cells focuses on repairing damaged tissues using the body's own restorative mechanism. Stem cells are especially important because they possess self renewal capabilities and can differentiate into specialized cells, including neurons. Researchers believe stem cells may help restore neural networks, reduce inflammation, and also support surviving brain cells. Okay, the several stem cell types that I've investigated and people have investigated for neurodegenerative treatments are included embryonic stem cells have or ESCS have high differentiation potential, but they raise ethical concerns, which I will cover in a couple slides. And then there's also induced pluripotent stem cells or iPSCs, and they are patient-derived cells that reduce immune rejection risk. The next one is mesenchymal stem cells or MSCS. They are widely studied due to their accessibility and strong immunodulatory effects. And fourth one is neural stem cells or NSCS. They can directly support growth and repair of neural tissues. And then there's also finally the last one, dental pulp stem cells or DPSCS. They are derived from dental tissue and have shown potential for neural regeneration. Okay, for the methodology and for the research I reviewed is that I used narrative review approach. The relevant studies were collected from multiple scientific databases, including but not limited by PubMed, Embassy, Science Direct, and Web of Science. And then the review focused on publications from 2016 until 2025. That is very focused, yeah. That I didn't use anything other than from that time frame. And then this reflects the rapid growth of stem cells application in neurodegenerative diseases. And after screening and exclusion of 90 plus research papers, 14 eligible studies were then further analyzed by me. Now, how can stem cells help? Stem cells therapy may improve Alzheimer's and Parkinson's through several mechanisms. I included four of them. The first one is that stem cells may replace damaged neurons and support synaptogenesis. Second one is that they can reduce toxic protein and aggregates such as amyloid beta, tau, and alpha synuclein. The third one is that stem cells release neurotrophic factors like BDNF and GDNF that helps neurons survive. Finally, and the fourth one, is that they may regulate inflammation and create a more supportive neural environment. Okay, the major findings from this review is that one of the major discrepancy between laboratory success and actual clinical outcomes. There's 71% of reviewed studies emphasizing on promising mechanism and early therapeutic signals, but on the other hand, there's only 14% demonstrated strong functional recovery and safety in clinical settings. There's a huge discrepancy there, and this highlights the difficulty of translating successful animal studies into effective human treatments. Each stem cell types present different advantages and challenges. For example, iPSCs allow personalized therapy and reduced immune rejection, but strict monitoring is necessary because of tumorigenic risks. That's what I said, it was unhuman. And MSCs are highly accessible and possess strong immunomodulatory properties. Meanwhile, neural stem cells provide direct and neural support, although survival and integration into host tissue remain difficult. These are the brief findings and some of the results I found in Parkinson's and Alzheimer's. For the Parkinson's disease, this one, I included 3 human models, and they used for the first one is NPCS, and the second one is MSCS, and the third one is autologous adipo SE derived SVF. And then the second one is Alzheimer's, brief finding. The animal models included 2 humans and 1 rat model. For the type cells used, it is a HSCT, and then human iPSCs, SES, and then there's also HUM SES. Okay, what is the future direction for neurodegenerative treatments? Yeah, one of the most promising future directions is the use of extracellular vesicles derived from stem cells. These vesicles acts as cell-free therapeutic carriers. Unlike whole cell transplantation, they present significantly lower tumor risk while delivering beneficial molecules across the blood-brain barrier. Because of these advantages, many researchers now view extracellular vesicles as a safer and more clinically viable alternative. Despite strong theoretical potential, major barriers still prevent widespread clinical application, and transplanted cells often fail to survive after injection. And then tumor formation and immune rejection remain major concerns for this treatment. And in addition, studies frequently use inconsistent methodologies, cell sources, and outcome measurements, making standardization extremely difficult. So, in conclusion, stem cells-based regenerative medicine demonstrates remarkable potential for treating Alzheimer's and Parkinson's disease. preclinical studies consistently show improvement in cognitive and motor function through neural replacement and neuroprotection. However, translating these findings into successful human therapies remain challenging due to safety concerns and inconsistent clinical outcomes. Among emerging strategies, extracellular vesicles may represent the most practical future direction for safer regenerative treatments. Okay, that's all from my research paper presentation about neurodegeneration treatments of stem cells. Thank you, and that's all from me and my research.